Hi students, I am Dr. M. Ashraf Majrooh, Professor of Community Medicine. I welcome you in the learning session of Epidemic Investigation. This is the 12th session on epidemiology. The agenda of this session include terminology of disease dynamics, scope and concept of epidemic, public health emergency of international concern and epidemic, strategic approach and objective of epidemic investigation, confirmation and verification of epidemic, tracking extent and gravity of epidemic, determining cause and source, compilation and dissemination of report. So let's see the agenda points one by one. First, the terminology of disease dynamics. The disease dynamics are described in terms of endemic, epidemic, pandemic, sporadic, exotic, episodic, zoonotic. So let's define these terms in brief. Endemic is baseline level of disease in human population in a given point of time, and this is the usual occurrence of the disease. Epidemic is unusual occurrence of disease at specific time and place. And pandemic, epidemics occurring across the countries, across the geographical boundaries, and these may involve the regions and the globe at large. The sporadic disease occur infrequently, irregularly at specific areas. So occasional cases of disease in a given area are known as sporadic. Exotic, the usual baseline occurrence of disease in animals. Episodic, usual occurrence of disease in animals. And zoonotic, disease of animal transmissible to human population. So these are the basic terms in disease dynamics. Let's move forward for understanding the disease dynamics. In disease dynamics, the most important term is endemic. Endemic is the usual occurrence of the disease or health-related event in a given territory in a specific time. And this may be the usual frequency of the disease in a given area, and that may be the usual place, endemic place. The diseases are known as endemic when they are usually occurring in a given place. And the usual time mean the diseases are occurring currently in a given point of time. So these are the characteristic of the endemic. And the endemics are routinely dealt in public health, and the priorities are set and interventions are designed to deal with the endemic diseases. On the other hand, if we talk about epidemics, unusual occurrence of disease or health related event, and the unusualness may be unusual frequency, unusual place and unusual time. So in these cases, these are the public health emergency of immediate concern, and these are dealt immediately. Now, the public health emergencies of international concern. Under the International Health Regulation 2005, epidemics are now falling under the domain of public health emergencies of international concern. The scope of public health emergency is not limited to any specific disease or manner of transmission, but apply to new and ever-changing public health risks. It covers illness or medical conditions irrespective of origin or source that present or could present significant harm to humans. The scope of public health emergencies of international concerns and epidemics. Now we can discuss the various domains of epidemic and public health emergencies of international concern. These include disease already under surveillance. These are the tetanus, poliomyelitis, human influenza, severe acute respiratory syndrome, Middle East respiratory syndrome, and dengue fever. These are the examples in this domain. And the other domain is high epidemic potential diseases. These include the cholera, plague, yellow fever, viral hemorrhagic fever, and COVID-19. Principal causes of mortality. These are the pneumonia, diarrheal diseases, tuberculosis, HIV, AIDS, and causes of maternal mortality. The other domain is non-communicable diseases. These are now called as slow modern epidemics. These include hypertension, coronary heart disease, diabetes mellitus, cancers, accidents and injuries. Still another domain is environmental risks and hazards. That may be nuclear accidents, bioterrorism, weapons of mass destruction. Still another, the natural disaster also include in the public health emergencies of international concern. These may be the famines, floods, or earthquakes. So these are the examples of public health emergencies of international concerns and epidemics. And this is the wider scope of epidemic. Objective of epidemic investigation and control to define the magnitude of epidemic and distribution by time, place and person. To determine the condition and factors associated with the epidemic, to identify the sources of epidemic, to make recommendation for prevention in present and future. The strategic approach to epidemic investigation include the sequential steps. These steps include confirmation and verification of epidemic, then mapping the extent and gravity of epidemic, exploring the cause and sources, and reporting the epidemic. These are the steps, and what we do under confirmation, we scrutinize the media reports and the complaints launched by the people. Then we review the surveillance reports and disease early warning system and health management information data. And then we verify and confirm the epidemic. In mapping the extent in this step, we define the population at risk, then make rapid search of all cases, mapping the distribution of cases, initiation of emergency control measures. In exploring the sources, developing and testing the etiological hypothesis, and determining the cause, what is the cause and what is the mode of transmission and the risk factors. In reporting, we report the extent, gravity and geographical distribution, causes, potential risk factors of epidemics are reported and recommendations for current and future controls are made. So these are the essential steps. We will describe in detail the salient features of these epidemic investigation steps. First is the scrutiny of data and information. The usual sources of data for epidemics include the electronic and media reports and complaints of the health authorities launched by the people, and then clinical cases reported from the healthcare setting, and unusual fluctuation in the clinical cases may trigger the epidemic investigation. Then surveillance reports can generate the data, and the review of reports may lead to epidemic investigation. Then review of routine data can trigger the epidemic investigation. Then endemic indices of the diseases, they are kept under vigilance so that any change in behavior of endemic diseases that can trigger the epidemic investigation. So the confirmation and verification of epidemic can be done under two conditions. If the disease is endemic and known, and the other condition if the disease is non-endemic or unknown. And we have different queries for these two situations. In endemic diseases or known diseases, we ask the question, what is the usual frequency of disease? What is prevailing endemic index of the disease? And disease frequency more than usual index is suggestive of epidemic. More than 2 standard deviation of median index of the disease is treated as epidemic. In non-endemic or unknown syndrome, is the disease fatal in usual place of occurrence? Is it unknown fatal syndrome likely to have mass impact? For these two questions, a single case or multiple cases should be treated as an epidemic. A single case or cases of a disease declared as eradicated or eliminated will be treated as an epidemic. So, this is the situation where unknown or non-endemic diseases, they are confirmed as epidemic. Let's see the investigation landmarks. If we see the investigation landmarks, these include the index case, primary case, secondary case, and attack rates of the cases. The index case, the first case reported to epidemiologist for investigation of an epidemic is known as index case. And the primary case, the first case of epidemic that actually occur in community is known as primary case. And sometime index case may be a primary case, may be an index case. The secondary, the people developing disease after they are exposed to primary cases within one incubation period, they are known as secondary cases. Then the attack rates. The attack rate, simply attack rate is defined as incidence in the population at risk. And the secondary attack rate is defined as incidence among the contacts during the one incubation period. So these are the epidemiological terms and landmarks in epidemic investigation. Then tracking epidemic. In tracking epidemic, first is the case definition. Case definition are diagnostic criteria if disease is already known or endemic. And syndromic case definition if the disease is unknown. So first we have to use the standard diagnostic procedures, and in case of unknown disease, the syndromic case definition must be desired. Case finding. Looking and counting the confirmed cases of disease or syndrome among the suspected communities or population is the process of case finding. Then contact tracing, follow up the people who were contact whether they developed disease or not is the contact tracing. Finding the secondary attack rates. The attack rates among the contacts will be the secondary attack rates. Then plotting the epidemic data, the geographical spot mapping of cases, drawing epidemic investigation curve, and tracking the trajectories of the epidemics. So these are the tools which are used for epidemic investigation. let's see the epidemic investigation tool. First is the spot mapping. If you look at this is the example of spot mapping. The wild polio cases in last 6 months, July 2014 to January 2015. And this is indicating the clustering of cases in certain areas, and this gives at a glance where the cases are there, and this is the territorial distribution of the cases. So the spot mapping and various softwares they are used for spot mapping the epidemic. The other important tool is the epidemic incidence curve. If we look at the epidemic incidence curve, on y-axis are the number of cases of disease, and on x-axis is the time, and time is plotted in days, months, or weeks. And if we look at the trajectory of the epidemic, this is the baseline, and this is the endemic, usual occurrence in geographical area, and here there is abrupt unusual increase in number of cases, and this is how the endemic disease is changed into epidemic in excess of normal. So let's see the point source epidemic. In point source, this is the graph showing the point source epidemic, and this is the epidemic incidence curve. Here is the number of cases on y-axis, and on x-axis is the number of days, first day to 13 days. This is typical point source epidemic. In point source epidemic curve, all the cases within one incubation period curve show a single peak and then drop to the baseline, and the single common source of infection or contamination is there. So this is the point source epidemic. In comparison to this point source epidemic, there is progressive propagated epidemic graph. If we look at the daily plotting of cases of COVID-19 in Pakistan from 24th Feb to 27th July 2020, it is the slow growing curve, and then it is moving upward and slowly moving towards baseline, but it has not yet touched to the baseline. So if we see the characteristic of propagated epidemic, it starts with the point source and progressively spread. Here we see the first case, which was the index case, and then in 24th February, and then this progressive curve is moving upward. Slow grow and prolonged rise. Curve takes many peaks. Cases occur in multiple incubation periods. There is person to person transmission. The person to person transmission is the reason for propagation and progress. Attack rates and fatality are usually higher than the point source epidemic. Here you can see the epidemic incidence curve of dengue fever in Pakistan. Here we can see the two peaks which are declared as epidemic. In 2011 epidemic, this yellow curve is showing, and this green curve is showing 2013 epidemic. And this is the baseline, and this is the epidemic incidence curve for dengue fever. Methods of epidemic surveillance include active surveillance. In active surveillance, health workers actively engage to search the cases in the community, and it needs more time and resources, but its coverage is more comprehensive. On the other hand, passive surveillance. In passive surveillance, cases are depicted in healthcare settings where symptomatic patient report. Specific data or public health emergencies is systematically reported in passive surveillance. In sentinel surveillance, specific diagnostic and lab facilities are used to confirm the cases. Sentinel surveillance needs more resources and technology for case reporting. If we summarize the steps which we have described up till now, the information of epidemic and then confirmation of epidemic, and then side by side the diagnosis and searching of cases, contact tracing, environmental assessment. These are the investigation steps. On the other hand, side by side are the preventive actions. These include isolation and treatment, disinfection, vaccination and vector control, and then surveillance. And all these steps then lead to etiological hypothesis. Now we will briefly go through the how we find the etiology, the investigation of cause of an epidemic. In first step, the review of data and trajectories of the epidemic curve and spot mapping. And in next step, collection uh, of circumstantial evidence and testing the suspected sources. In next step, the developing etiological hypothesis by logical reasoning on available data. And then finally testing the hypothesis by robust study design. And finally, infer the causal association through systematic logical reasoning process. Usually the Hill's criteria is used to establish the causal association. Now, summation of the report. The epidemic report must consist of following essential component, that is socio-demographic profile of the affected area, overall impact of epidemic in terms of human lives and financial losses and social impacts, sources, etiology, and potential risk factors for current and future transmission, detailed account of preventive action taken and suggested for future, detailed recommendation to prevent and mitigate such risk in the people and the territories at risk. So this was about the submission of report, and this was the summary of epidemic investigation. Thank you for sparing your time, and we will continue with epidemiology in the next session.